Hello, this is Dr. Stanley Lang, and welcome to this broadcast. This is a webinar dedicated to answering the question, can you reverse diabetes? Can diabetes be reversed? And so for many people, the answer to that question is no. That's what they've been taught to believe. And I'd like to share an alternative view today and answer a series of questions that often come up as I treat patients and counsel patients who have diabetes. So we're going to go through a series of questions to address the bigger picture of can diabetes be reversed. First of all, the first question that we need to address is what's the difference between type 1 and type 2 diabetes? And with type 1 diabetes, the problem is that the person is deficient in insulin. In type 2 diabetes, the problem is that the person has too much insulin, but their body is resistant to their own insulin. So again, type 1 diabetes is that the person has become very deficient in insulin, is not making enough to survive, and needs to have it replaced. In type 2 diabetes, there is more than enough insulin, but it isn't working right. The receptors are not working correct. So next question I'd like to address is, how does type 2 diabetes happen? How does type 2 diabetes happen? And the answer to this question is basically by challenging the system over and over again with eating foods that cause the body to pump out too much insulin meal after meal, day after day, week after week, year after year. The body becomes resistant to its own insulin, and eventually the insulin stops working well enough to keep the blood sugar in control. And so the body reaches a point of maximizing its insulin production, and at that point, blood sugars start to creep up in spite of the fact that there's actually more insulin than normal on board. And it's largely because of the consumption of high glycemic foods. That means foods that raise the blood sugar quickly, that we do this over and over to ourselves and essentially break the system. And it causes the body to become resistant to its own insulin. And so the insulin really doesn't do the job it was meant to do in the first place. So next question, why does insulin resistance happen? Why does it happen? Okay, one good analogy that I think is helpful in understanding the concept of insulin resistance is if you've ever gone into a room that is very loud noise, almost to the point that it's painful to listen to, and you stay in that room for maybe 5 to 10 minutes. After a while, the noise doesn't sound so loud. It may be even tolerable for you to be there, and the reason that it sounds different isn't because the volume went down, it's because the receptors in your system reset themselves so that the situation would be more tolerable. Now, an analogy for the body in terms of hormonally is that when hormone levels are pushed up way above normal, the receptors start changing and they become less responsive to that hormonal signal. It's like when the insulin levels go up higher and higher and higher in response to eating foods that raise the blood sugar quickly, this is the equivalent of hormonal shouting. And so the receptors become dysfunctional at that point. It's a little bit like if you came home and somebody had stuck a key in your keyhole, you wouldn't be able to open your door. You wouldn't be able to stick your key in the keyhole because something's already in there. It's jamming the keyhole, and that causes that keyhole to be dysfunctional. And that's a bit like how the insulin receptor dysfunction happens. So instead of the keyhole, the analogy here is that the keyhole is like the insulin receptor, and the key is like insulin. And so if something is goofed up inside the keyhole or in the receptor, the insulin doesn't plug in and turn the receptor on and cause it to do what it's supposed to do, which is to bring sugar into the cell that's floating around inside the bloodstream. So that's essentially how insulin resistance happens, and I'll go into more detail with some other questions. Now, a related question is, how does stress make diabetes worse? How does stress make diabetes worse? Excuse me. Stress makes diabetes worse because when we're under chronic stress, the body shifts to making more of a couple of different hormones. One is cortisol and another one is adrenaline. There's some other hormonal shifts that happen too, but under the effects of chronic stress, this hormonal shift causes some of this insulin resistance that I just told you about to happen. So chronic stress pushes the body more in the direction of resistance to your own insulin. So a good understanding of what stress is, chronic stress, is this little diagram, which shows what I would call the expectation reality gap. So there are two kinds of stress, acute stress and chronic stress. Acute stress could be described as the experience you would have if you're walking down the road and all of a sudden this dog starts chasing you and you run for your life and you barely make it to a tree. You climb up the tree, you're just out of reach of the dog's snapping jaws, and then you have a moment to catch your breath, relax. The owner comes by, grabs the dog, pulls it away, and you go home. Even though you're shaken, eventually you're able to recover. You're kind of over the event, and that's what we would call acute stress. Now imagine that that same scenario happens, but every day you walk by the same place and the same dog chases you in the same way. You barely escape with your life each time. And so you start anticipating this happening, and that's what chronic stress feels like. That's what chronic stress is. There's a huge gap between where you want to be and what your reality is. And the bigger the gap, the more the experience of stress. So chronic stress pushes us more into this insulin resistant state. So I bring that up because if you want to reverse diabetes, controlling chronic stress is a big part of the picture. So the next question I'd like to address is, does reverse mean cure? Does reversing your diabetes mean a cure of your diabetes? And the answer is no. By reversing diabetes, I do not mean that your whole system is now cured and you can go about your merry way eating whatever you want to do without any consequences. By reversing diabetes, I mean that the chemical changes associated with diabetes, the high blood sugar, the changes in cholesterol, triglyceride, the changes in the good cholesterol called HDL, the blood pressure changes, all of these things, those can be reversed back to normal and then held in that normal state by following the program that I and other doctors have developed to cause this reversal to happen in the first place. Now, this implies that you're not using any medication. So by diabetes reversal, I don't mean controlling by medication. I'm talking about by lifestyle. You completely change the body's chemistry so that when you test the blood, the crucial blood tests, they're all normal. And then you can maintain that state by following that lifestyle. So does diabetes mean cure? No, it doesn't mean that you're completely restored to the way you were when you were a little kid, but it does mean that you can have blood tests that test completely normal if you follow the program without the need of medication, either oral medicine or insulin. So the next question I'd like to address is, what does low glycemic mean? What does low glycemic mean? So glycemic index is a phrase that means or describes how fast the blood sugar rises after you eat a certain kind of a food. Now, many decades ago now, doctors started analyzing almost every food on the face of the planet to see how fast does the blood sugar rise when you consume this particular food. Now, the glycemic index basically refers to carbohydrates, which are chains of sugar molecules. Now, some of these sugar molecules are bound together in such a way that the body breaks those chains down very slowly. In other places, or in other foods, the blood sugar or the sugar molecules are held together in a way that the body can break them down very quickly. Now, if it breaks them down slowly, we call that a low glycemic food. If it breaks it down quickly, we call that a high glycemic food. So an example of a low glycemic food would be most of the vegetables. An example of high glycemic food would be most of the grains, uh, baked potatoes, mashed potatoes, rice. These would all be high glycemic foods because the body can literally chop them up into little sugar molecules very quickly, which is then absorbed, and then that causes the blood sugar to rise quickly. High glycemic. Low glycemic, the body chops it up very slowly. The sugar goes into the body slowly, and that causes a much different change inside the body. So another question that people ask me is, what's the difference between glycemic index and glycemic load? So glycemic index, I just talked about, it refers to individual foods and how fast those individual foods raise the blood sugar. Glycemic load looks at how much actual carbohydrate there is in that particular food, and it combines the concept of this volume of calories with how fast the blood sugar rises. So glycemic load is a bit more complicated concept, and I don't like to use it as much, even though it's become more popular among scientists nowadays rather than glycemic index. But I think glycemic index is a lot simpler concept to understand for patients in particular. They can get it that this particular food is broken down by the body very quickly, or it's broken down very slowly. And it's something that they can actually test on their own with blood sugar testing equipment that they have at home. So the difference between glycemic index and glycemic load, we're talking about basically the same thing, but glycemic index is a simpler concept. It's what I'm going to be talking about in the rest of this presentation. I don't really use the term glycemic load, although it has become a preferred term amongst a lot of people that specialize in diabetes care. Now, a related question is, will the ADA diet work? Will the American Diabetes Association diet work? And the answer is, if you are trying to reverse diabetes, no, it will not work. If you're trying to help improve your control, the answer is yes, it will work. It's usually a much better diet than what people were doing before they became diabetic. But unfortunately, it allows too many foods that are high glycemic to completely effectively reverse diabetes, except in a minority of cases. But if you want to be sure that you're on the right path that is reversing your diabetes, then the ADA diet is not your choice. Diets that are more restrictive in the high glycemic foods are absolutely crucial if you want to reverse your diabetes. Are these diets hard to follow? No, they're just different from the ADA diet, and we can get into that in more detail in other questions. So another related question is, what about the ketogenic diet? How does that work, and is that low glycemic? So first of all, to talk about the ketogenic diet, we need to talk also about the idea that we don't even use the word or the phrase glycemic index when we're talking about proteins and fats, because these foods are not collections of sugar molecules that the body chops up and turns into sugar. The process by which those are created are changed into energy is quite different in terms of the body's pathways. So a ketogenic diet is really a diet that is very high in fat and in protein. And the basis for the ketogenic diet is this, that the body can survive on nutrients that are called ketones. And ketones are derived by the body digesting fat for fuel. So a ketogenic diet has very little carbohydrate in it, no fruit, no sugar, and a little bit of vegetable, but nothing else in terms of carbohydrate, but it has lots of protein and fat. Now, high protein diets that do not have high amounts of high quality fats are not true ketogenic diets, and they're not healthy. But a true ketogenic diet is basically a version of a low glycemic diet. It's an extremely low glycemic diet, and therefore it is one pathway to reversing your diabetes. In my experience, the ketogenic diet is harder to follow than the usual dietary strategy that I give to patients who are desiring to reverse their diabetes. For a while, it works to be able to eat bacon every day as your meal 3 times a day for people that love bacon. But after about 3 months, it gets kind of tiring. So you don't have to be that restrictive to reverse type 2 diabetes almost all the time. There are a couple of exceptions, but I'm talking in general now. You don't need to do that most of the time. So the ketogenic diet has been proven to be healthy. It does work. If it's done right, it's healthy. But it is harder to follow in my experience. So I'm not going to really focus on the ketogenic diet as the main option for people who desire to use that kind of a strategy. Again, the ketogenic diet is using ketone bodies, which derive from fat, as the main fuel for the body rather than sugar as the main fuel for the body. So the next question I'd like to review is this: do I need exercise to reverse diabetes mellitus or type 2 diabetes? Do I need exercise to reverse diabetes? Now, you probably know the answer to that question. Yes, you do. Now, the question is, what kind of exercise do you need to do? And fortunately, there's a lot of different ways you can skin that cat, and we're going to talk about that. But there's a couple of different reasons that exercise is important. First of all, it's crucial because of the metabolic changes that happen as a consequence of exercise. But second of all, it's crucial because what it does mentally to us. So research done more than 2 decades ago compared people that lost substantial amounts of weight using mainly dietary means and did not have a consistent exercise program, and compared those to people who lost substantial amounts of weight, and it was part of the program was that they were following a significant exercise program. Now, a year later, they looked at these populations and looked at what percent of people had kept the weight off in the people that weren't exercising regularly to start with, and it never was part of their program, versus those that had exercise on an almost daily basis. And the differences were stark. About 5 to 6% of people had kept the weight off in the non-exercise group, and about 50% of people had kept the weight off in the exercise group. Now, that wasn't because they were burning lots of calories. It was because of a lot of other things that happen as a result of exercise, including what we've talked about before, chronic stress reduction, including its effect on how the body burns fat, including to some extent on burning calories, but that's really the minimal part of what exercise does for the body as I go into more detail. So yes, you do need exercise if you want any kind of a hope of reversing diabetes. It needs to be part of your regular routine on an almost daily basis. Now, the next question is also related to this question about exercise, and it's asking the question, well, what are the kinds of cardiovascular exercise that I can do? Basically, there's 2 types, aerobic and high-intensity interval training. Now, we can also talk about subaerobic. First of all, let's define aerobic. There's a couple of different definitions out there, but basically, I'm going to kind of average it. Pardon me. With aerobic exercise, the goal is to hit 60 to 70% of your maximum heart rate and hold it there for 20 to 30 minutes nonstop. And then you allow yourself about 5 minutes to cool down, and ideally you've spent about 5 minutes warming up before you start that workout. So with traditional aerobic exercise, the goal is not to get to maximum exercise. You're aiming at about 70% of your maximum heart rate. And what that does is it ratchets up your metabolic rate substantially above what we would be doing with subaerobic exercise. So if you just go out and take a leisurely walk, that is way better than doing nothing. But if you take a very vigorous walk, that's way better than a leisurely walk. If you hit actually cardiovascular levels of aerobic activity, that's even better. But what is even better than that is this second choice, which is called high-intensity interval training. Now, I'm not going to go into a lot of detail except to just give you a cursory overview of what that would look like. If you went down to a track and field event and you watched the racers take a turn at a 100-yard dash, let's say, and the racer ran as fast as he could and then crossed the finish line and finished finish that 100 yards, you would notice that he's panting really hard for a while and then breathing harder for a while, then pretty much after a while he's back to normal. Now, the reason he's panting really hard is that he's created what we call an oxygen debt. He was pushing himself past what we would call the aerobic threshold, which means he needed to activate a second way of creating energy in his body, which is called the anaerobic pathway, the without oxygen pathway. Now, the neat thing about high-intensity interval training is that if you do it that way, it activates a completely different type of chemistry in your body that burns fat more easily. It increases growth hormone release, and that causes a lot more positive changes in your body's chemistry. So high-intensity interval training would be something like this. The person runs that 100-yard dash. He stops running and catches his breath and walks while he catches his breath. The moment that he catches his breath, he starts running as hard as he can again. He runs that 100 yards and starts walking again to catch his breath. He does it a third time. He does it a fourth time. Finally, he does it 12 to 15 times. That would be a typical high-intensity interval training workout. So the time investment is still going to be less than 30 minutes for most people doing an HIIT workout. There's a lot of really good research that's been done on this. I'm not going to go into detail. There are a couple of doctors who've been pioneering this. Dr. L. Sears in particular has been promoting this for many years. So I want to give credit where credit is due. He's written a lot, talked a lot on the subject. There are a lot of different variations on what he has developed. But the long and the short of it, there's two ways to do cardiovascular exercise. One is aerobic. The second is this high-intensity interval training. And the second one works better than the first in terms of reversing diabetes, but both work well for the goal of reversing your diabetes. The next question I'd like to answer is strength training necessary? Is strength training necessary to reverse your diabetes? And the answer is no, but it's really helpful. And now the reason I can say the no is that I've had many patients reverse their diabetes who did not do strength training. But let's explain why strength training is really helpful if you do want to reverse diabetes, and I strongly encourage it as part of any kind of a true reversal program. Now, we talked about this insulin resistance issue at the early part of this webinar, and the thing about insulin resistance is that the insulin receptors are only on a few parts of the cells that are in our body. Now, all of the cells don't need insulin receptors to be able to use sugar, but some of them do, and muscles are one of them. So muscles are like the kitchen cabinets in your kitchen, places to store sugar. So let's imagine that you've got a whole pile of new dishes coming in and you've got to store them someplace, and you've only got 2 cabinets. Now you've got a couple of alternatives. You've got to store those dishes maybe down in the basement, or you build more cabinets. And if you build 10 times as many cabinets, you can store a lot more of those dishes. So let's imagine that the dishes are like sugar molecules that are dumping into your system after you eat a meal. When you are building a lot more muscle, you're building a lot more insulin receptors, you're building a lot more places for the body to store extra sugar after a meal. So strength training helps to build the muscle mass that is like adding more cabinets to your kitchen to store the dishes. And in this case, the dishes are analogous to the blood sugar molecules. And the body then stores these blood sugar molecules in the form of glycogen, which is a sugar-water complex. So the more muscle fibers you have, the more muscle cells you have, the more muscle mass you have, the more places you have to store the extra sugar. And in addition, you've got more tissue that has a higher metabolic rate, and it's burning more calories just by sitting or standing around and not doing that much. So yes, strength training is very, very helpful to reversing diabetes because of the multiple things that it does favorably to this insulin resistance issue. If you've got more places for the insulin to plug into, then you need less insulin pushing the receptors that aren't working right. In addition, these kinds of exercise help the body to fix the receptor resistance. And so insulin resistance diminishes when you're doing both the high intensity training the aerobic workout, and the strength training. Now, the next question I'd like to review is stress reduction really necessary? Is stress reduction really necessary? And the answer is yes. If you do not do something that is a regular stress reduction strategy, the chance of you reversing diabetes is quite low, because what's going to happen is that as a result of the chronic stress, you're going to undermine over and over your goal of reversing diabetes you're going to undermine the different things that you need to do, which are dietary or exercise related. And that's just what happens in chronic stress that is untreated. So chronic stress can be treated in a lot of different ways, but if you don't have a strategy to deal with chronic stress, your chance of reversing diabetes is significantly diminished. And so I always include chronic stress reduction strategies in any kind of a diabetes reversal program. Of course, I recommend chronic stress reduction strategies for anybody that wants to be healthy anyway, because chronic stress causes a lot of different problems in the body and is responsible for, or at least contributing to, almost all chronic disease. But in particular, if you want to reverse diabetes, you need to be addressing the chronic stress in your life in a way that is helpful and healing. So a related question would be, what's the best way to reduce stress, or best way to reduce chronic stress? And the answer to that is in a whole person approach. So I'm not going to go into the details of all the different ways that you can reduce stress in this simple response, but I do want to say that you are body, mind, and spirit, and it is much more likely that you will reverse chronic stress in a healthy way if you use your physical, your emotional, and your spiritual faculties all at the same time, all on the same day, to try to reduce the chronic stress. And if you do that, you will have a much higher chance of experiencing the diminishment of stress in your life and its negative effect on you. So as far as the details of how you do that spiritually, emotionally, physically, I'm not going to go into that in this video, except to say that in terms of what we've already talked about as far as the exercise, that's a very powerful way to reduce stress via the physical pathway. So this is a little bit of a diagram connectedness of body, mind, and spirit, and how all of that, the different parts of us overlap and work with each other, to how they overlap and work with each other to produce a whole person approach to health and wellness. So when you just pay attention to only the physical, you're leaving out a lot of the resources in your body to help you accomplish whatever your goal is, whether it's a health goal or a different kind of a goal. So a whole person approach sees equal contribution of physical, emotional, and spiritual as the strategy for dealing with whatever you're dealing with, in this case, chronic stress. Now, a question that I often get is, will this approach help my cholesterol? Will this approach of diabetes reversal help my cholesterol? And the answer is yes, definitely. One of the main features of insulin resistance is that the cholesterol ratio is thrown off severely because the good cholesterol is severely suppressed in this condition called insulin resistance. It's also called metabolic syndrome. And in metabolic syndrome, typically the triglycerides, which is a type of fat that floats around in the bloodstream, is much higher. The level is much higher than it should be. And the good cholesterol level, called HDL, is much lower than it should be. And that is a consequence of this insulin resistance problem that I was talking about earlier. When you reverse insulin resistance completely, that allows the liver to start to make more HDL again. It'll start manufacturing more of the HDL if it has enough of the nutrients it needs to make the HDL. Now that's a different subject, but the point being that if you reverse insulin resistance, if you reverse what it causes, metabolic syndrome, then you will also reverse the main feature that is pushing the HDL down, and the HDL levels will start to rise on their own. I have seen patients go from very low HDL levels to levels that are in the high normal range just by following these strategies. I've seen it many, many times. It takes many, many months to have that turnaround happen. It doesn't happen overnight, but it does happen if you continue to follow the program. A related question: will I lose weight when I follow the diabetes reversal program? And the answer, of course, is yes, you will lose weight. It's not a weight loss program. It is a program that's designed to reverse insulin resistance. And as a consequence, you lose weight because one of the features of insulin resistance is that the high insulin levels trigger the body into fat storage chemistry. And so when you let the insulin levels drop as a result of following this program, the signal that is causing the body to hold on to fat goes away, and your body literally can start burning the fat as fuel much more easily, especially if you're using the right exercise program that further stimulates the use of fat as fuel. So weight loss happens as a side effect of following this program. Another related question is, will this help my blood pressure? Will this diabetes reversal program help my blood pressure if I have high blood pressure? And the answer is definitely yes. One of the side effects of insulin resistance syndrome or metabolic syndrome, this high insulin level that's pushing against these receptors that don't work, is that it's a signal to the body to raise the blood pressure. So when you start to reverse the insulin resistance, what happens is it's like pulling the plug on one of the major signals for the blood pressure to go up. Pardon me. And so when that plug is pulled by reversing the insulin resistance, the blood pressure starts to drop down. And it doesn't drop down because you lost weight. It drops down because you reversed the insulin resistance. You dropped weight at the same time because of the same thing that you unplugged. The insulin resistance is driving the weight to go up. It's driving the blood pressure to go up. It's driving triglycerides to go up. And it's pushing the good cholesterol down. So all of those things get better all at once as you reverse insulin resistance. In addition, the blood sugar goes down. So a question that I often get is, I have neuropathy. Will this help me? I have neuropathy. Will this diabetes reversal program help? And the answer is maybe. We do know that in previous studies that in people who have had neuropathy and sometimes significant symptoms, that if they normalize their blood sugar, a significant percentage of those people will start to get healing of the nerves after about a year. So this reversal of neuropathy, if it's going to happen, it's going to be a very slow process. It'll happen down the road, and it's not guaranteed, but the chances are a whole lot better than if you don't try to reverse your diabetes. Now, a lot of people have neuropathy as a symptom of diabetes because that's one of the main presenting symptoms that people come to the doctor with. In other words, they didn't know they had diabetes. They're coming in with these nerve symptoms, and it turns out that they've had diabetes probably for many years. They developed nerve damage, which we call neuropathy, and that's one of the features that brought them in. And so there is good news that you can have a chance of reversing the neuropathy, and certainly you decrease the odds of it getting a lot worse if you follow the diabetes reversal program. And there are many patients who actually notice the neuropathy symptoms worsening during the day when their blood sugar is too high. So the nerve function is definitely connected to how high the blood sugars are, which are, when they're higher than normal, are definitely toxic to your nerves. Question: how long does it take to reverse diabetes mellitus? How long does it take to reverse type 2 diabetes? The answer is, well, it depends on how long you've had it, how bad it is. Now, if you've had diabetes for 20 years, you're in horrible control, you're on 4 medicines, you don't have any chance of reversing your diabetes with this program. But you definitely have a chance of decreasing the amount of medicine and having a lot better control than you do if you're not following this program. If you've had diabetes for a lot less period of time, you're not on so much medication or on no medicine at all yet, it's about 9 months to reverse the diabetes in people who are following the program to a T. It takes 9 to 12 months to reverse. Now, some people will have significant improvement in those numbers within 2 to 3 months, but to completely reverse everything, all of the things that I've been talking about, it takes 9 to 12 months to reverse, but you start to notice the benefit. Excuse me. You start to notice the benefit way before that 9-month mark. But it may take 9 months to see all of these biochemical abnormalities reverse themselves, particularly the one that is related to the low HDL level, the low good cholesterol. That's one of the last things that improves if you follow this program the way I've described it to you. So it's not an overnight wonder. It's not you get better in a week. It's not better in a month. You'll see a lot of improvement in a week and a month. But in terms of reversal, it's a multi-month process. So another question that I get is, can I ever eat these high glycemic foods again? And the answer is, yes, you can, but not for the first 9 months, because if you really want to reverse the diabetes, you have to pull all the signals away that are pushing you into this insulin resistance state, into this metabolic syndrome state. You have to unplug all of those signals, and so that means don't eat the high glycemic foods. Now, obviously, nobody's perfect, so almost everybody so-called cheats occasionally. What I tell people is only God knows how many times you can so-called cheat and still achieve the goal that you're aiming for. So I encourage you to aim for not cheating, and when occasionally there's an occasion such as a party that you want to go to and enjoy, then I say go ahead and enjoy. But in terms of in general, you want to avoid the high glycemic foods for the first 9 months. Now, the first 3 months are absolutely crucial. You have to be 100% compliant if you want any chance of reversing the biochemistry related to this insulin resistance, the metabolic syndrome, the subsequent diabetes. If you really want to reverse it, you've got to be completely compliant with that, or you're not going to be successful. So diabetes is a serious condition. A serious approach is needed, and you got to give it your whole effort and understand that you can't cheat in those first 3 months. And if you don't cheat in the first 3 months, the next 3 months are going to be a whole lot easier anyway, because you're not going to crave those foods after 3 months. So after 9 months, after 12 months, much of the body's chemistry is similar to what it was before you became diabetic, before you had metabolic syndrome. And occasional exposure to those high glycemic foods, especially if they're just used at the end of a meal, will have minimal impact on your body's chemistry. So occasionally you'll be able to eat those kind of foods in the future if you follow the program carefully in the early months of the program. Excuse me. The next question: will this help my heart if I follow this diabetes reversal program? The answer is it'll definitely help your heart on different levels. First of all, high blood sugars are toxic to every tissue in your body. Second of all, high blood sugars accelerate hardening of the arteries or blockages of the coronary arteries, and of course that leads to heart attacks. So one of the most powerful things that you can do to decrease coronary artery disease is have normal blood sugars. So if you reverse your diabetes, you dramatically decrease your risk for coronary artery disease. You not only fix the blood sugar, you fix the cholesterol imbalances that I talked about before. Dramatically decreases your risk of heart problems if you reverse diabetes. Another question: will this program help my brain? If I do the diabetes reversal program, will it help my brain? The answer is it will definitely help your brain. The research shows that even very mild elevations of blood sugar cause a marked increased risk of Alzheimer's dementia. Much higher levels of blood sugar cause an even higher risk. So you decrease your risk of dementia substantially by normalizing your blood sugar. Not too many people I know look forward to becoming demented, but they live their lives as if they don't care. It does make a difference. You can decrease your risk of dementia by normalizing your blood sugar, by reversing your diabetes, by reversing the metabolic syndrome, the insulin resistance. So yes, definitely very good for your brain if you reverse your diabetes and follow this program. The next question: why not just use medication to control the blood sugar and eat whatever I want to? Well, the reason is, first of all, your blood sugars aren't going to be in perfect control if you're using medication. Best case scenario, they're going to be higher than they should be some of the time. And as I already alluded to, even some elevation of the blood sugar is bad for the brain. But related to that whole thing is that you're exposing your body to all of these different medications And there is no medicine that is free of side effects. There is no medicine that's free of complication. And the one thing that you are not fixing if you're using medicine to control your diabetes is this condition that is called microinflammation. One of the things I didn't mention when I was talking about this insulin resistance syndrome is one of the things that happens when the insulin levels are high is that high insulin levels are pro-inflammatory. They increase the inflammation in your body. So even though you might be controlling your blood sugar, your insulin resistance has not been fixed if you didn't follow the program. So you might be on different medicines. It looks like your blood sugars look good, but because you're still in insulin resistance, the inflammation is markedly increased in your body, and it's affecting every tissue in your body, particularly the brain and the heart. So it's far better to reverse your diabetes than to control it with medication. Far better to reverse it than to control it. And most people who start the process of reversal can do it if they want to. It's just you have to decide whether you want to do it. So I mentioned microinflammation just a moment ago. What is this microinflammation all about? And so what if I have it? Well, microinflammation means inflammation at a very micro level, meaning that you can't feel it. So inflammation, excuse me. So inflammation is a situation where the body's a certain cascade of chemical reactions have turned on that cause the body to release chemicals that cause swelling, redness, and usually pain to happen in certain areas. Arthritis would be a good example of an inflamed joint. A bad sprain would be an example of inflammation. Falling and scraping your knee and what the knee looks like, that's an example of inflammation. That's macro inflammation, inflammation on the big level. Microinflammation is happening at the cell level. And there are many, many things that contribute to microinflammation, but microinflammation is basically one of the major factors that causes you to age prematurely, causes you to develop different diseases prematurely. And if you can control microinflammation, you slow down aging in all of your organ systems, you decrease the risk of premature disease in all of your organ systems. So it's way better to control the microinflammation by controlling the insulin resistance and the metabolic syndrome rather than just treating it with medication and hoping that you'll live a long life. Hoping that you'll live a long life isn't quite as good as doing the things that increase the odds of living a long life without disease, and that is reversing the metabolic abnormalities that are going on in your body. So the next question is, what's the safest sweetener? So diabetics have been really taken advantage of because the food industry knows that you're supposed to avoid sugars. You're supposed to avoid the kind of things that are very commonly eaten in our society, all of the desserts, all of the things that, as you already know now, are high glycemic foods. And so the food industry has developed alternative chemicals rather than sugar to make the desserts that people want to eat. And these artificial sweeteners, unfortunately, are all bad for the body in some way. I'm not going to go into a lot of detail on how all of the artificial sweeteners are bad for the body. I'll just explain one of them, which is the most common one, which is Splenda. Correction. I'll explain what one of them is, which is sucralose. And sucralose is the most common sweetener used now. It has a brand name that I'm not going to mention at present, but sucralose, one of the things that it does is that it actually causes a disturbance in the good bacteria in your gut, what we call the probiotics. It decreases the probiotics in your gut. Now, we know that the body's immune system is very much tied to the right balance of bacteria in the gut, and this particular artificial sweetener whacks those good bacteria. The second thing that's been proven with this particular sweetener is it worsens insulin resistance. So that's not the solution for the best sweetener, because it has negative effects. All of the artificial sweeteners have negative effects. I advise staying away from all of them. None of them have been shown to help lose weight, and they all have significant metabolic consequences. However, fortunately, there are some natural sweeteners that are not sugar that you can use. Now, the discussion of all of these different natural sweeteners is beyond the scope of this video. I discuss that in other areas, but the point is, stay away from artificial sweeteners. They're all bad for you. So the last question related to that is, well, what about agave? I've heard that that's low glycemic. How about using that as a sweetener? Well, the problem with agave is that agave is almost pure fructose. So fructose is the fruit sugar, fructose is the sugar that is in fruit. And what happens in diabetes is that the body becomes very sensitive to fructose. Now, the average person can consume easily 8 servings of fruit a day and not affect them metabolically at all. The fructose that's in those servings of fruit are fine. But by the time somebody has moved into metabolic syndrome, insulin resistance, and in particular diabetes, excuse me, by the time they've moved into insulin resistance, metabolic syndrome, and diabetes, they have become very sensitive to fructose. And fructose pushes the body into worse insulin resistance. So even though fructose tastes sweet, even though it does not raise the blood sugar quickly, it pushes the body metabolically into worsening insulin resistance syndrome. So you don't want to expose yourself to large amounts of fructose. Unfortunately, agave is mainly fructose. So for somebody who's not diabetic, not in metabolic syndrome, using some modest amounts of fructose as a sweetener in the form of agave, no big deal. But for somebody that wants to reverse, excuse me, but for somebody that wants to reverse their diabetes, that wants to reverse their insulin resistance, that wants to reverse their metabolic syndrome, that wants to change the blood pressure, the HDL cholesterol, and all the other stuff I've talked about, you want to minimize concentrated sources of fructose. Of course, that means all of the pop or soda that has high fructose corn syrup as a sweetener is going to be according to the plan that I usually give patients. That amount of fruit usually doesn't have a significant negative effect for most diabetics. So avoiding fructose is not absolutely crucial for most people who want to reverse their diabetes. Now, there are a lot of doctors who do teach that you have to cut out all fruit. I have found that that's not true. If you do the right other things, you can still enjoy fruit. Now, I have a couple of patients who have very advanced diabetes, and they absolutely have to avoid fruit because of the reasons I just mentioned. But for most people, they can still enjoy fruit if it's consumed in the right way, in the right balance with other foods. So these are the questions that I see the most often in diabetics who are trying to reverse their diabetes. These are brief answers that hint at more complex answers, but they're sufficient at least to guide you in the right direction to begin to reverse your diabetes. And if you want to have more information about how to do that, I encourage you to click on the link that is at the bottom of this video. It will take you to resources that will allow you to start this path of reversing insulin resistance and metabolic syndrome in the comfort of your home if you wish to. So I wish you well. God bless you, and have a great day.